Hi, everyone. Thank you for coming to today's new patient webinar. I'm really excited because this is my second one and I am a periodontal specialist. So this is my passion. I'm really excited to be sharing this information with you because this is very common amongst the population and I don't think a lot of people know about it. So I am here to answer all of your questions. We have an hour. So, what I'll be covering today is gum recession. You might have heard of this from your dentist. Maybe they sent you to a periodontist. The sensitivity, the smile changes, and the bone loss, no one warns you about. Yes. So, gum recession, most of the time we just think about our gums. We're not thinking about the bone that is actually underneath our gums that is also affected by the gum recession. What we'll be covering today in the next hour is going to be a little bit of an intro, the types of gum tissue that exist in everybody's mouth, what recession actually is, the symptoms that are associated with recession, the causes, the treatment. Then we're going to leave a couple minutes at the end for questions and answers. And if you stay all the way until the end, we will put a link into the chat where you can take a wellness smile assessment. And the wellness smile assessment is a 15 questions. It's about 10 minutes. It's really cool because I did it yesterday. And what it's going to do is it's going to help you uncover some of the issues that might be quietly affecting your mouth. And so that's going to be at the end. So wait for that link. And then also, everybody who's here today will be receiving an email tomorrow. So if you are in here, make sure you look out for an email tomorrow from us about an ebook. I'll go into that a little bit more later. But yeah, it's just a special gift that we're going to have for everyone here today, for all the participants. A little bit of an intro for those of you who don't know me. My name is Dr. Rosalie Gulla. I am a board certified periodontist. It's really funny because I think that the word not a lot of people know what periodontists actually do. Perio means around. So what I focus on in my specialty is I don't do any smart removals, which is mercury removals. I don't do any crowns, bridges, or anything like that. My main focus is on gum tissue, and I'm very passionate about it. I am also a specialist in dental implants. I am biologically trained, so I know all things about biocompatibility, EAV, meridians, all things holistic, biological, things like that. We are at Dr. Katy Toe's Center for Dental Wellness, which is in Katy, Texas. So if you ever wanted to come to Texas, come visit us here in Katy. And if you have any questions or you're on the brink of, I don't know if I really need this procedure, I have a couple of other questions, we have an excellent wellness dentistry patient care specialist. She is very experienced. She is going to help you answer all your questions, and I will give you the phone number on how to contact her. So if you have any questions about it whatsoever, if you want to get in contact with us here or see me for all of your gum tissue needs or even dental implants, I'll give you that phone number at the end. Luckily for me, within the news last week, a celebrity had this huge gum graft procedure. It was all over my news. It was even on our American Academy of Periodontics headlines. Kelly Ripa had gum surgery. And so a lot of people aren't really aware of what the gum surgery entails, but then here's this huge celebrity where she had to take off time from work from her podcast. She is with her husband live with Kelly and Mark Consuelos, I think his name is. But yeah, she had to take off of work. And so the headlines were all, what is the good, bad habit that she has? Why did she have to get this gum surgery? It's the way that they had, had it on the headlines was that it was caused by aggressive over brushing. So I think that what happens is when people look at this and they see aggressive over brushing, oh my gosh, that just tells me I shouldn't brush my teeth too much or I shouldn't brush my teeth too hard. So people end up not brushing their teeth or taking care of their teeth. So the way that they marketed this headline, it was just to capture your attention. But what I'm going to do today is I'm going to go over all of this so that you can understand what aggressive overbrushing really entails, what to expect, and what are the symptoms and causes of why she needed this procedure. There are two different types of gum tissue, and this is not important in the fact that you don't really need to know this, but I do like to bring this part in because this is how I explain it to all the patients in my chair. There are two types of gum tissue. One that represents almost similar to the palm of our hand, and the other one is like the back of our hand, where it's very elastic. You can pull on it like this. So the one in the front of the hand is made to grip, it's very strong. That is our light pink gum tissue, which you see right here. It's thick. What it does is it holds and it binds around our natural teeth and it binds around dental implants and it helps protect against bacteria, plaque, all of those things. The other type of tissue that we have is like the back of our hand here. It's very elastic. So that's what you're going to find in your lips, cheeks, tongue. Very elastic. It allows you to open your mouth, close your mouth, do all these things, chew. What happens whenever we tend to overbrush is that we end up wearing away some of this type of tissue, and then all we have left is this tissue. These are some of the reasons why we might need gum grafting. This is how I explain it to my patients. There are different classification systems for it as well. Now, the reason why we as periodontists need to know this is because I do have to be upfront and say that this procedure is not always 100% predictable. So I'm going to go over kind of the reasons why, but we look at several reasons as to why you might be experiencing recession. And it's really important that you get down to the root cause of it all. So, what is recession? Whenever I had to come up with a title for my presentation, I wanted to do recession, not just an economic downfall. It's in your mouth too, but I didn't think that was really appropriate. And so we changed it to whatever it is now. But recession is caused whenever the gum starts to pull back from your teeth and your teeth end up looking longer. In this picture here of my patient, you can kind of see that his teeth do look longer than natural. And what happens for most people is whenever you experience the gums pulling back like that, I compare it to having a blanket. Your gum tissue is like a blanket covering your teeth, keeping it warm. So what happens whenever you pull that blanket back, your teeth end up getting cold. And then so you get cold and your teeth end up getting cold too. So I will say that the number one complaint that I get from patients whenever they come in experiencing recession is cold sensitivity. They're like, I can't drink cold water. I can't have my iced latte. How many of you guys have this experience? If you guys have cold teeth, type yes in the group chat right now so that I can see. A lot of people feel sensitivity whenever they eat or drink foods. For me, for example, like whenever I go to a restaurant, I'll ask for water without any ice in it because my teeth just get way too cold. If you're having cold sensitivity, you might be a good candidate for this procedure. If you're finding that you're avoiding foods that are a little too hot or a little too cold, that might be a sign as well. Now, obviously, another reason why the complaint that people come in is for the aesthetic concern. So you're going to see that in this picture here that the mouth and the teeth all look longer. They don't like that. Whenever they smile, all they see are the roots of the teeth, and then the roots are yellowish, so they don't like that. The teeth look long. But for me, what I'm more concerned with is something called attachment loss. So as you can see in this picture on the left, there isn't gum tissue covering the root all the way. Whenever the gum tissue doesn't cover the root all the way, there's bone underneath that gum tissue. If there's no tissue, then there's no bone. If there's no bone, what's going to happen to your tooth? Eventually, it's going to get loose and it's going to get wiggly, and then you might end up losing it. Another thing that recession can cause is you can see on the bottom here are gaps in your teeth or even notches in your teeth. I have recession, obviously, like I just said, I get really, really sensitive teeth. And I have these black triangles on the bottom, just like this picture. This picture is not a picture of my mouth, but recession does cause something called black triangles, where it's the spacing in between the teeth. What are the causes? All right. So being in biological dentistry, we always try to get down to the root cause of everything. There are many causes as to why you might have recession. These are all my patients here, as you can see. Gingival inflammation, which means that there is the redness around the gum tissue, as you can see on that upper right photo there. Whenever you are not taking care of your teeth, there's a lot of plaque and bacteria in your mouth. It's going to cause inflammation. Whenever there's inflammation, everything is super red, super puffy, super fiery. And then whenever you take a hard bristled toothbrush and then you go in and you're aggressively brushing your teeth really, really hard, it's going to wear that tissue away. Whenever that tissue gets worn away, it doesn't come back. I always tell my patients that it's not how hard you brush your teeth, it's how long you brush your teeth. A lot of people think that the harder bristle toothbrush, it's going to make their teeth feel cleaner. So what they end up doing is they end up brushing for a shorter amount of time, but harder. When you do that, it causes recession in the mouth. What I tell patients is get a soft bristle toothbrush, soft, extra soft. The softer it is, the better. Get a soft bristle toothbrush and brush for longer. Most people are brushing for under 2 minutes. They think that they're brushing for the correct amount of time, but if you actually put on a timer on your phone and try to go for 2 minutes, it's a lot longer than you think it is. So put on that timer, brush. Another thing that I tell patients is just switch over to an electric toothbrush. When you switch over to an electric toothbrush, you're going to have the vibrations clean for you. You can't aggressively brush with an electric toothbrush. The electric toothbrush also nowadays have pressure sensitive alarms. So if you're putting too much pressure on it, it'll kind of light up a little bit to say lighten up. The electric toothbrush, what generally happens is it shuts off after 2 minutes. And some people are like, I still don't feel like it's clean. You don't have to only brush for 2 minutes. You can actually brush for longer. So I always tell those patients to go for 2 cycles. Once it's done, just hit the button again and then go through the mouth all over again. And it's going to feel much cleaner. So, like I said, it's not about how hard you brush, it's about how long you brush. Super eruption, it could also be another cause of recession. That is the picture on the upper left there, where you see the tooth kind of floating above the other teeth, so it makes it look longer. Frenum attachment, that's also the upper right picture. A lot of people are very familiar with their lingual frenum because they get the tongue tie release, but there's also muscle attachments everywhere in the mouth. This one in the middle is a common one for causing recession. What happens is it's a muscle attachment. So every single time you talk, chew, laugh, drink, you're moving it, it's pulling, and it pulls so much that it ends up pulling the gum tissue down. Orthodontic movement is another reason why people may experience some recession in their mouth. The picture on the lower right is an example. What happens is the teeth end up, whenever you have crowded teeth, they're all sitting together. And then as you expand it, it pushes it out of the bony housing, pushing it out of the gum tissue. So if you don't have a good orthodontist and they're not really paying attention to the health of your gums, it could push it out like this picture on the lower right. And clenching and grinding. So clenching and grinding, the reason why it could cause recession as well, and that's the picture on the lower left here, is because of the shear forces. Whenever you put excessive force on your teeth like this, it's going to fracture because the enamel is very thin and it'll fracture. And then the more you brush it, it'll give this pattern. And that's called an abfraction. The reason why this is important is because a lot of patients will come in and they will say, oh, like I have recession, I have some root, I see some yellowing of my teeth, and my dentist wants to put a composite filling on it or some bonding on it. So it's really important that we get down to what the diagnosis is, what the root cause of the recession is, why do the teeth look longer before we do any treatment. The reason why I bring this up is because if you end up getting bonding on your tooth before you see a periodontist to get the gum graft, what can happen is whenever I do the graft, it's not going to attach to bonding because it's not a natural part of our body. What's going to happen is it'll just stay long. Your tooth is going to stay long. It's going to look pretty because it doesn't have that fracture anymore, but it's going to stay long. And then I'm no longer able to do the gum graft. So if you're ever faced with should you get bonding or should you get a gum graft, I recommend that you go see a periodontist first to see what the root cause of it is and if gum grafting is an option for you before you do the bonding. Because once you do the bonding, the gum graft is going to be very difficult to do. Like I said earlier, if you are not sure, you've been told before that you have recession in a few areas and you're not sure whether or not you need this procedure, give us a call. Talk to our wellness dentistry patient care specialist. She is very knowledgeable. She has years of experience. She's going to walk you through it and she's going to be able to answer your questions. But like I keep saying, number one, you have to find the root cause and address it. I won't do surgery on a patient if I don't know the reason why they have this recession in the first place. Because what's going to happen is they're going to end up going home doing the exact same thing that they've always been doing, not getting anything addressed like their airway issues, their clenching, grinding, their aggressive brushing. And then all my surgery will go to waste. They're going to go home and then you're just going to get recession all over again. Right? So, what I do first, always, I find the root cause. First, I ask, are you brushing with a soft bristle toothbrush? Is it a hard toothbrush? Or is your airway an issue? The reason why airway could be an issue for patients with recession is because when you have a constricted airway, and I'm not going to go into detail about this because I'm talking more about the gum grafting aspect of it, but when you have a constricted airway, number one, you tend to sleep with your mouth open because you can't breathe at night, you're snoring. When you sleep with your mouth open, you wake up, your mouth is dry. Your gums are red and inflamed. A dry mouth harbors bacteria more than someone who sleeps with their mouth closed. Because it harbors more bacteria, then there's more inflammation. Because there's more inflammation, there's a higher risk that whenever you brush your teeth, you're going to brush your gums away. Another reason why, if you are have airway issues, is because of the clenching and grinding. So if you are clenching and grinding and have fractions, like the fractures that I showed earlier, then a gum graft might not be the right fit for you. Now, after I address all of these other concerns, and they're like, yeah, I used to brush with a hard toothbrush, but then now I am, brushing with a soft toothbrush. Or, yeah, I did ortho. Now I have this one tooth that is long or whatever. Then that's whenever, if we can find the root cause, that's whenever it comes to me. Surgery. Unfortunately, gums can't grow back by themselves. But like I said earlier, there's two types of tissue in our mouth, this kind and this kind. This is the kind that we want. There's a lot of this kind on the roof of our mouth. The roof of our mouth is primarily composed of this thick tissue that is very sturdy. There is a grafting procedure that we can do where we take a piece from the roof of the mouth, transfer it to where there is recession, and then that way it doesn't necessarily grow back, but we are grafting it to help cover the defect. In this case over here, I show that after I'm done with one side of the mouth, where you can see on the left side here, and then the right side, you can see the difference in it already, where the recession is being covered. A couple sutures are being placed afterwards, and then, you have to make sure that you keep it clean, and then you come back, and then about 2 to 4 weeks later, maybe 6 weeks later, the sutures get removed. Another treatment option is orthodontics. If orthodontics is the reason, if the tooth is too far forward and that's the reason why you have recession, then braces could potentially move it back if you're eligible for that. Like it'll move the tooth back into the bony housing. Or like I said, if it's an abfraction, you might be able to do some cosmetic bonding to help, depending on the degree of the recession. So I have a couple of pictures here. These are pictures of my patients. This one, she has recession on her molar, and then you can start to see that her root is starting to form. In the tooth in the middle right here, you can see that she does have bonding in that one. And then this one, there's a metal crown. Now, what happens is whenever you begin to get recession around a metal crown, you get that metal show through. This is also the same if you have a metal implant in your mouth. So how many people have metal implants in their mouth? Just type yes in the chat. As you start to get recession, the titanium starts to show through a little bit, and then you get this like graying of the gum line. A gum graft might be able to help with that, depending, as long as it's not infected. So in this patient specifically, we did the gum graft, and then so you can see the bonding was difficult because what happens is I have to remove the bonding, and then once I remove the bonding, the patient might feel a little sensitive because I took off the covering, the composite that was on their tooth. But you can now see that the molar in the back, all the way to the left, is now covered. The silver show through is no longer there. And this is immediately after surgery. So you see, there's not a lot of blood. There's not a lot of sutures everywhere. It's just, to hold everything down. Mm. If you've gone to your dentist and then they say, oh, we'll just put a bonding over it, you can imagine that if you look at this picture here on the upper left, that if a dentist puts bonding on that tooth, now the tooth is forever going to look long, right? If a dentist puts bonding on that tooth and you don't take care of the reason why you have recession in the first place, which it could have been from, let's say, aggressive brushing, you're still going to get recession after this. You're not building that gum tissue back up. The longevity of this tooth is now going to be compromised. This is another example. This patient had an implant placed whenever she was 23. Now she's 36, so she's still very young. But as we grow older, our teeth are still shifting, but implants don't shift. That's why it's really important for you to get implants at a later age in your life. I don't place implants on anyone under 21, but that's another conversation to be had. This patient even waited until she was 23, and everyone thought that she was done growing, but the teeth around started to shift. And because the teeth around started to shift, you begin to see that metal show through. And she didn't like it. It's in her front tooth. So every single time she smiles, you're going to see that metal show through. So we were able to do a gum graft on her. You can see that the thickness of it has increased, and then there's no more silver show through. So it works on implants. It also works on natural teeth. This is another example. This is a patient of mine. She came in and she has the black triangles. Now I'm going to be honest and transparent with you. There's no way that we can fill the gap of a black triangle. We can't grow bone or gum tissue into air. Once you see this, the only way that you can really fix it is maybe with a veneer or some bonding. And we've got excellent, Dr. Katy, Dr. Lou, and Dr. Jones are excellent with cosmetic bonding. So in this case here, it's a great example of the frenum attachment that I was talking about in the front. We've got very elastic tissue. So you can see the teeth look very long. There's inflammation present. Whenever patients come to me like this, I tell them the truth. I say, I'm not going to be able to cover the black triangles that you already have, but my concern right now isn't trying to cover the black triangles. My concern right now is how do I thicken up this tissue to help the attachment loss and the bone loss that you are already experiencing on this tooth. If you don't get this gum graft, what is going to happen? Look at that inflammation. You're going to brush your teeth. You're going to wear your gums away even more. You're going to expose more root structure to the point where the entire root is exposed. And then eventually, we're not going to be able to do a gum graft anymore. My objective for this patient, and I told her straight up, my objective for you now is to build healthy gum tissue so that you can hang on to this tooth for a longer amount of time. My objective for this tooth for you is going to be building this thick gum tissue. So whatever toothbrush you use, if you're using a soft, hard, whatever, electric, that it's going to be able to withstand the pressures of whatever you're doing to it. So we did the gum graft. I took the tissue from the top palate of the mouth, and then I placed it on the bottom. So now you can see it's a lot thicker. I've moved that frenum attachment. Now it's no longer there. There's no attachment there anymore. So if she wiggles her lip, there's nothing that's going to be pulling her gum tissue down. She no longer has that inflammation. And just in this case here, I was able to get some recession coverage for her. All of her teeth are in line and even. So if she wants to go get some type of bonding now, she can. It's going to be more natural looking. But if you go back to the original picture, we have some teeth that are in line and then one super long tooth that dips all the way down. And if you're going to do bonding on that, first, it's not going to help you protect the tooth with the gum tissue. Second, it's not going to look aesthetic because you have one super long tooth, right? Doesn't save you from bone loss, doesn't protect the tooth, doesn't help with tooth longevity whatsoever. This is the picture that I showed at the beginning of the presentation where I talked about the tooth that was supra erupted, which means that it erupts a little bit higher than the rest of the teeth. She wanted to get braces to help push that tooth down, but her orthodontist, luckily, someone who pays attention to the gum tissue and respects the gum tissue, referred her over to her periodontist, to me, to have it assessed. So what did I look at? I looked at the inflammation around it. I looked at what type of gum tissue is left. In her case, she didn't really have sensitivity, but she did not want to lose that tooth. She wanted to get braces to align everything. Again, I told her, you can see in this picture here, that she does have a black triangle. And so I told her, I said, honest with her, I'm honest, transparent. I'm not going to be able to cover that black triangle, but I do want to extend the lifetime of this tooth, and we're going to help protect it. Because if we don't do this, what's going to happen is your toothbrush is going to continue brushing and you're going to continue wearing it away. And then you can see that she almost has 50%, maybe a little bit more of her root showing. She might end up losing this tooth. Okay. She's a young female. You don't want to smile with a missing tooth down here, right? So we did the surgery. And again, you can see that now the frenum attachment is gone. We have this thick tissue from the palate, the roof of the mouth, that got transferred down to the bottom. This tooth is going to last much longer. And then she's going to go see the orthodontist, and the orthodontist is going to feel much better about pushing that tooth into line because now it has a protective covering, right? The most common question I get asked is, when you take this tissue from the roof of the mouth, does it hurt? I'm going to be completely honest. Okay. This is what patients tell me. I tell them that it feels like a really bad pizza burn. You ever bit into a pizza, a hot chicken wing, you burn the roof of your mouth. It's annoying as heck, right? But it's only annoying if you mess with it, which means if you're not messing with it, maybe it's throbbing a little bit, but if you're touching it with your tongue, if you're eating chips after that, if you're continuing to eat and something is rubbing on it, it's going to irritate it. But if I protect it with something, then you're not going to feel it as much. And of course, I do recommend we send all our surgical patients home with a goodie bag with arnica, with ibuprofen, Tylenol, things like that, homeopaths to take to help decrease the amount of discomfort. This is a surgery. Okay, I'm going to be honest, it is a surgery. So you're going to expect some amount of discomfort with it, but is it excruciating pain? No. I'm going to say it's not. Knowing this already, we create an Invisalign retainer for the top of the mouth, which is the clear retainer that you wear for braces. And instead of cutting out the palate, I leave the palate on and have the patients wear for about 2 weeks. Also, we draw blood from everyone. We spin it down. We extract the platelets, the PRF. We place it back into the palate to help expedite healing, and it acts also as a Band-Aid. When you put on the retainer, it completely protects it from everything, protects it from the tongue, it protects it from food. You're going to be on a soft food diet, of course, but it helps a lot, okay? And after 2 weeks, it's mostly healed. It's like skin, whenever you take off your Band-Aid after 2 weeks, it's mostly healed. And then after a while, you have a little bit of a scar, but in the mouth, there's almost no scars. And then eventually the tissue grows back. So you can actually do this over and over and over again. I don't think you want to, but it's the upper palate, it just keeps making this tissue over and over again. And then maybe in 2 months, 3 months, 6 months, whatever down the line, we can take tissue from it again. So what Kelly Ripa was saying, the grafting method. Oh, they took this tissue from the roof of her mouth, putting it over the lower gum line to cover exposed areas. Yes, that's exactly what I was just talking about. There are some strict post-op rules. No talking for 10 days. So this is in the news, okay? No talking for 10 days to allow the delicate graft to heal. She has to be limited to soft foods. She had to avoid straws, flossing, pulling her lip down to check the area. Her husband, Mark Consuelo, said that it was very painful and she has a very high pain tolerance, but there was significant discomfort with this. Like I said, it is a surgery, so you will experience discomfort. But knowing this, we already come in with the retainer for you to wear. We already give you the arnica, right? Whenever you're in the chair, we give it to you sublingually. We give you ibuprofen, things like that, you know? And if you stay on the clock with it, it's going to be, you'll be able to handle it. But if you don't and you're chasing the pain, sometimes it's a little bit more difficult to control. Now, the reason why I guess this made such big news was because she, has her live show, she has her podcast. So she actually had to take off of 10 days because she wasn't allowed to talk. I recently had a patient come in and she speaks for a living. And so whenever I did this procedure, I told her she couldn't talk, and then she didn't talk for 7 days because then she had a speaking engagement. I saw her before her speaking engagement, and then I saw that she was healed, and so I gave her the okay, and then she ended up doing her speaking engagement, but it was still able to heal. The reason why it's no talking is because if you're watching me talk right now, you can see if we're doing a gum graft down here on my lower lip, you can see how much my lower lip is moving. You can see whenever I smile, talk, chew, laugh, ha, do anything, sing, eat, swallow, drink. Look at how much my lower lip is moving. If you're doing a grafting procedure, do you want to be moving around it that much? Do you think that the blood vessels are going to come in and heal in that area? No. So we recommend not speaking. But what I ended up telling my patient was, if you really need to talk, then talk. Or, don't go telling any stories or anything like that. But if you really need to talk, then talk. Otherwise, text. Otherwise, email. I also told her that if she really, really needed to talk for the next week, then pretend like your lower lip is numb. So I told her to talk like this, or she's no longer moving her lower lip. The reason why we don't want you to talk is because we don't want all this movement and this muscle movement here. But if you act like your lip is numb and then you end up talking like this, it's not that bad. Yes, soft foods. After an extraction, I tell people to eat soft foods. Avoid drinking from a straw. Of course, this is a surgical area. You're not trying to just eat foods and mess around with it. I do tell patients all the time, this is comparative to a burn victim. Whenever a patient has a burn on their arm and then, you get a skin graft from somewhere else on the body and then you transfer it, do you go out and you go play baseball with it? No, you lay there still until the graft takes and then you let it heal. You keep it clean, right? You eat healthy to make sure there's no inflammation, there's no infection, no bacteria. So it's pretty common sense, you know what I mean? Making sure to keep this area clean. Post-op instructions that I give my patients: limit speech. Not, not completely cut it out. But if you don't have to tell a story, then just text it. We're texting all the time nowadays anyways. Liquid diet. Yes, after the first day, whenever you come home, maybe a smoothie, no straws. Drink from the cup, pour it in your mouth if possible because you don't want to drink like that. Bone broth is great. We give all of our patients a little bag of bone broth in their goodie bag to take home so that they have that. It's got a lot of nutrition in it. Soft foods. What I tell patients afterwards is eat soft foods. What does soft food mean? Well, whenever you go home, you're not going to want to eat anything crunchy like peanuts, granola bars, and chips. You're not going to want to bite into anything like a pizza or a sandwich or an apple like this. Cut up all your foods, put it to the back. You're going to eat foods like maybe some mashed potatoes. And then as you get more comfortable, scrambled eggs, macaroni and cheese. And as you get more comfortable, steamed veggies, steamed fish, anything that you can really just cut up with a fork, put it to the back, chew it up a little bit. I recommend wearing the retainer on the top roof of your mouth while you eat, because then that'll help protect it from all the foods that's touching the roof of your mouth. This is the most important thing that I tell patients because people get so curious whenever they get home. They're like, oh gosh, I want to see what it looks like. So what I do in the chair before they even leave, I give them a mirror. I said, I'm going to show you what this looks like right now. So whenever you go home, you don't get curious. You don't pull down that lip. I'm going to give you this mirror and I'm going to pull down your lip for you. So I pull down the lip or I pull up the lip wherever I do the surgery and I show them so they can see it right away. I also love taking pictures of this. So I have a lot of pictures of the procedure because you can see the before and after and it's immediate. Okay. What happens whenever patients go home and they pull down their lips to look at the stitches is this area that's trying to heal now heal up, right? Now you go home, you pull down your lip, what happens? Everything goes back down. It defeats the whole purpose. Don't look at it, okay? I'll show you what it looks like in the chair. No straws, keep it clean. We give patients Stella Life rinse, Argentine 23, which is a hydrocolloidal silver to keep everything clean. Are antibiotics necessary? No, not always. But if you develop an infection, I do recommend taking antibiotics. Because this is a part of your body that I'm taking from one to another, generally there's no infection and there's no rejection because it's your own body, right? But let's say if you don't want to use the roof of your mouth and you want to use something else, what else can you use? There are products on the market. They are called acellular dermal matrix. They are donated human tissue. And so we generally use acellular dermal matrix in, let's say, breast reconstruction for someone who might have had a mastectomy. We use it also for burn victims. We use it for inside the mouth for gum grafting. So it is a medical product. And so patients sometimes just don't want to cut into the roof of their mouth. They just don't want to do that anymore. So we do have other options. Now, in our practice, we make sure that everyone who comes in is biocompatible with the materials we use before we put it in your body. There is a way that we can check. We check all of our materials. We check our local anesthetics. We check all of our bonding materials. I check all of the bone grafting materials, the mineral grafting, and the membranes that I use before we place it back into a body. So what is compatible with me might not be compatible with you. We check to make sure that it's compatible if you do not want to access the roof of your mouth. In those cases, whenever we're using something else, I do recommend antibiotics. And what I generally tell my patients is you can take some oregano oil, and that does help decrease the amount of bacteria in the mouth. You have to keep it clean yourself, and this is how you keep it clean. And I'll give them a list of instructions on how to do it. If by day 2 or 3 you're noticing a weird taste and it's kind of metallic and then you develop a fever, that is a sign of an infection. So that is whenever I recommend that you take an antibiotic. Give us a call and I'll send an antibiotic into your pharmacy. And so that brings me to the end of the presentation. I have a lot of these pictures of patients with different grafting. I spared everybody the surgical pictures of it. But if you are curious as to what the surgery might look like, or, what other types of surgeries that I do as a periodontist, I am on Instagram at the biological periodontist. I am also on TikTok as at periomama. And then if you have any questions, please feel free to email me at any time. My email address is rosalieperio@gmail.com. And so if what I said resonated with you tonight, like if you are experiencing cold sensitivity, if you're missing gum tissue and you've been putting it off for a long time, and what Kelly Ripa said was that her dentist was monitoring this for a while, and then he eventually just told her that she doesn't have the luxury of time anymore. So she already knew this for 5 years, and then she kept putting it off, kept putting it off. Eventually, she just had to come back, and then he said that I thought it was in here. She doesn't have the luxury of time anymore. So then she had to do the procedure. I will say the longer you wait, the more difficult it becomes and the less predictable it becomes. But if this resonates, if you are curious as to what the next steps might be, then please reach out to our patient care specialist. She is excellent at answering all the questions. It's very simple. We are here for teeth longevity. You want to keep the teeth you have in your mouth for as long as you can because that is the only set that you have, okay? She's here to explain things to you. She's not here to pressure you. She's here to help you gain clarity into what to do next. We are also going to drop a link into the chat for the wellness smile assessment, which I mentioned a little bit earlier. And like I said, I took the quiz yesterday and it was really interesting. But you get to find out what some hidden oral issues might be that might be affecting your mouth that, don't commonly get addressed. And so if you are having inflammation, fatigue, immune stress, airway issues, or some unknown wellness symptom, and then you've been trying to figure it out for a long time, this quiz might be able to help you, get to the bottom of it. What it does is it gives you a personalized risk score. So it's going to give you your top 3 likely oral burdens, and it's going to rate it from green, yellow, green meaning good, yellow, moderate, red, you're at high risk. And it'll kind of help you navigate to what the next steps might be. And as a thank you for being here today, like I said earlier, please look in your emails and check for the ebook that we'll be sending you tomorrow. And then also reach out to our patient care specialist. Our phone number is 281-392-8450. But if you are like, no, my dentist told me a long time ago that I had this gum graft, I know I need it. You can just go straight onto our website, katytodds.com/contact, and then fill out your information, and then we will get in contact with you. The first step is going to be a consultation, which is going to be a conversation with me. And that conversation is going to give you a lot of information. So there's no pressure in it whatsoever. I'm going to be able to assess you, diagnose you, see what I recommend for you. And then that way you can collect your answers and then see what to do next. There's no pressure. You don't have to do it. Um, and with that, that is it. I'm going to go over to the Q&A. Yeah, see, so I'm seeing a lot of yeses because this sensitivity it's very common. I don't even order my drinks with ice anymore. So, what do you think of using red light therapy to restore gum tissue? That's a great question. Like I said, there's no way to really grow gum tissue back up height wise once you've brushed it away. What red light therapy does is it really penetrates deep underneath your epithelial layer, and then it helps produce collagen and it helps stimulate the cells to produce things that help heal, to help decrease inflammation, help with all the good things. But unfortunately, red light itself is not going to grow gum tissue. We give red lights to all the surgery patients afterwards because we want to help with the healing. But red light itself, you won't be able to put it on your gum tissue to restore it, unfortunately. Okay, next question. Are electric toothbrushes good or bad for your teeth and gums? Electric toothbrushes are, let's see, I don't want to say always, but I will say that it is good because the electric toothbrush is going to vibrate, and the vibrations are what are cleaning your teeth. This versus a manual toothbrush where you're putting a lot of pressure and then you're kind of brushing it back and forth is going to wear the gum away a little bit faster. But if you have an electric toothbrush that controls the vibrations, that lights up whenever you have too much pressure, is really going to help with the gum health and longevity. Now, um, a lot of people say that they do use their electric toothbrush, but then they still have inflammation, and it's because I think that what's happening is they're focusing more on their teeth and they're not pushing their toothbrush closer to their gum to remove the plaque and bacteria. So I would recommend putting the bristles closer to your gum tissue to make sure that you clean the plaque around the gum tissue because that's where the inflammation will be. Metal plate screws in my jaw area would affect it. It shouldn't, but I guess it depends on where it's at. It won't affect the surgery though, but it might have affected and caused recession. Will the graft hold? It will fold if you follow instructions by not pulling down your lip, by not eating hard foods, by following all the instructions, not giving a lecture, doing a presentation immediately after the graft. If you just go home, rest, don't talk, take care of it, no infection, it will hold. And the sutures help to hold it a lot as well. Do some insurances pay for a gum graft? Some do, most don't. They think that it's an elective procedure. They don't like to pay for anything that they don't have to. If you still have gums in your mouth, they're going to say, well, you still have gums. Why do I need to pay for more gum tissue for you? But some do, and it really depends on your provider. I would say that maybe the person that you work for depends on the plan that they get for you as well. I have a twisted front tooth. Would the tooth need to be straightened before a graft? Okay, so this is a good question because it allows for two different specialties to work together. I have worked I work a lot with orthodontists, and what we do is we talk to each other. Which direction is this tooth moving in? Is it going to be moving it out of the gum tissue? If it is, maybe you should do the gum graft first before you do the orthodontic movement. If not, then you can do the orthodontic movement and then maybe we can monitor it and see where it goes. And then if needed, then we can do the gum graft. So it kind of goes both ways. It's a little bit difficult because I don't see your tooth itself. I mean, yourself, I don't see your tooth, so I'm not sure. But it is a conversation. And like I said, come in for a consultation, even with an orthodontist. You just ask them and then they'll be able to know. Let's see. EDS, connective tissue disease. Yes, that is a little bit more difficult, and it is more of a systemic issue that we would need to go in a little bit more detail because, like I said, it depends on how much gum tissue you have left. There's two different types of gum procedures. Maybe taking your gum tissue isn't the best idea. Maybe we need to get the collagen matrix, things like that. Let's see. How do dental So the reason why we're different here at Dr. Katy Toe's Center of Dental Wellness is because we are a biological office, and then by that, Dr. Katy is really, really a big proponent on, making sure that we get to the root cause of everything. We look at all patients' blood work before we get started. She is very, and we are all, that is our philosophy here, is that we are all very whole body thinking, that we're not just in the mouth. We're not just drill and fill where you just come in and we'll do whatever and then you can leave and then we took care of the problem for now. It's more about longevity and wellness and how long this will last in your body and how it could change your entire health. I would recommend, yes, that you get it straightened out before you get it grafted. Mm. Um, Yeah, Aurora, that's just going to be a more of a CBCT. It would depend on what the bone looks like as well. So, like I said, the gum tissue does follow the bone. So, if you are missing bone, then the gum tissue does follow it. It's all connected, right? If you're losing bone, that might be the root cause of the problem. So, you might have to be addressing the bone instead of a gum graft. So, yeah, go to your periodontist. We are all that's all we do all day. That's all we love to do. We love gums. I love growing gums. I love taking care of gums. But yeah, if there aren't any more questions, thank you so much. Let's see. We're going to drop the link in here soon with the quiz. I'm really excited for everyone to take it because I took it yesterday and I have my score. So if you guys take the quiz, it might help you figure out what the root cause of everything is. And also, don't forget to look in your email, your inbox tomorrow, reach out to our patient care specialist. She is very knowledgeable, and I hope to see everyone again soon. Bye. Thank you.